So let us understand why is kidney disease so important. So every person has two kidneys, and kidney does the function of filtering the blood. So whatever substance is not required by the body, it is a function of the kidney to remove them from the blood and the body and excrete it in the urine. Just like the heart, the kidney functions tirelessly throughout the entire life of the person. There are certain diseases in which the kidney can get affected, and these include diabetes and hypertension. Hypertension is also called as blood pressure. So in patients who are hypertensive, where the BP is high, they need to control their blood pressure properly so that it does not damage the kidneys. It is also important that you do a regular check on the function of the kidney, especially if you are hypertensive. It is common knowledge that patients who are diabetics, the kidney is going to get affected to some extent. However, by taking proper precautions, we can delay the effect of diabetes on the kidney. There are several common tests that are available where we can get to know how the kidney is functioning. Blood tests like serum creatinine, urine routine, urinary albumin. These are the common tests that can be done to check if the kidney is functioning properly. So coming to the first test, what is serum creatinine? Creatinine is a metabolite of muscle. So it's a waste product from muscle metabolism. It is excreted by the kidney, and any increase in creatinine in the blood level indicates the kidney is not performing its function properly. From the serum creatinine and the age, we can derive another test which is called as eGFR. It is a mathematical calculation applied to creatinine and the age of the patient, which gives us an idea of the filtering capacity of the kidney. The full form of eGFR is electronically calculated glomerular filtration rate. It is nothing but the filtration capability of the kidney. Usually it is more than 125 in healthy adults. However, as the kidney function gets compromised, if it falls below 60, then we say that the kidney is not performing well, and we call this a stage 1 renal disease. So a simple test like creatinine along with the patient of the age of the patient can tell us the status of the filtering capability of the kidney. As we know, urine when it is formed, it contains only waste products. So ideally proteins, especially albumin, should not get excreted in the urine. Why? Because it is required by the body. However, when the kidney has damaged or kidney is affected due to disease or because of blood pressure or because of diabetes, small amounts of albumin, which is a protein, can get excreted in the urine. And this small amount of protein is called as microalbumin. So presence of increased amount of microalbumin in the kidney is an indicator of renal disease. And the important thing is, it happens 10 to 20 years before the patient can have symptoms. It is also indirect evidence of cardiac disease. So it's a very useful test, a simple test that can be done on first urine sample to know if the patient is going to have renal disease or cardiac disease 20 years afterwards. It's a very, very simple and effective test. Besides blood tests, one should also do a sonography, maybe once in 2 years or 3 years, to see if there are renal stones. Sometimes kidney stones can go undetected and they can damage the kidney. It is surprising to know that although kidney is such an important organ, God has given us almost 80% more capacity than what we require. So it is only when the kidney function falls below the 20% capacity that patient will have symptoms. So many times patient feels, मैं तो ठीक हूँ, मुझे कुछ नहीं हो रहा है, I'm absolutely fine. So why should I have kidney disease? That's a myth. It is important to note that when symptoms appear and if they are related to kidney disease, that means the kidney is affected. And many times this is reversible. So if you take proper care and proper precautions, you can keep your kidney healthy till we pass away. Patients who are diabetes and hypertensive need to take extra precaution because these diseases can affect the kidneys. Another important thing I would like to tell you is that we have to see the amount of sodium that we consume in our diet. Sodium is nothing but common salt that is present in sea and what we eat. Today, because of the fast food culture and snacking that is available, these snacks contain a lot of sodium, and sodium has an effect or puts pressure on the kidneys. So it's always better to consume as much less sodium as possible, even in patients who are healthy, who have no disease and whose kidneys are functioning normally. Even in these patients, it is wise to decrease the amount of sodium intake and is always healthy for the body. So whenever you take a snack or those wafers that you like, please check the label on the box. It mentions the amount of sodium that is present per serving. Please see to it that you restrict the amount of sodium that you consume. It will go a long way in helping to keep your kidneys healthy. Please remember, kidney disease is not something that kills a patient very quickly. It can remain for a very many years, and a person with kidney disease has emotional and financial burden not only on himself but on the entire family. Few simple tests and few simple precautions taken wisely and in time will prevent all these problems. Thank you so much.